From MTN News, this is Montana This Morning.
I'm Jonathan Amberian in Helena. As the heat continues, I'll take a look at some of the resources available for people who are especially impacted by it.
And the State Department of Justice says the death rate from illegal use of fentanyl use in Montana is spiking. Just ahead, learn why that drug can be so deadly.
New technology is promising to stop millions of robocalls from reaching our phones. I'm Dina Demetrius, and I'll tell you how it works.
6:30, there's a live shot from our community hospital of Anaconda ICAM. Meantime, right now at 6:30, extreme heat Montana experiencing can be particularly hard for vulnerable populations, including seniors. TN's Jonathan Amberian found out more about the challenges, some of the resources that are available.
As the heat continues day after day, organizations that serve vulnerable populations say it's important that people know they always have options. Leaders with Rocky Mountain Development Council, which runs the Helena Senior Center and other services for seniors, say heat has already been a serious concern for the people they serve.
It's been a year where there's been an extended period of hot weather, and so we really want to encourage our clients to be able to come down, enjoy Rocky, where they can enjoy an environment that might be a little cooler than their home environment.
They say the seniors they work with may be more likely to stay in their homes and keep them closed up, and less likely to get the hydration they need.
We want to make sure that they know that we are a resource for them. So if they have any concerns with the temperature within their homes, please give us a call.
Rocky is currently having a new air conditioning system installed to replace old window units at the neighborhood center. That should keep the dining area even cooler starting on Thursday. The center will be open Wednesday as well.
We are open for you to come in, take advantage of activities, come in, read a book, visit with others in the cool new air conditioning that we have.
While you're dealing with the heat, Rocky has several important tips. Drink plenty of water even if you think you've hydrated enough. Stay out of the direct sun whenever possible, especially if you're on medications. And keep your windows and curtains closed in the heat of the day, but open them up at night to let in fresh air. In Helena, Jonathan Amberian, MTN News.
And there's no making light of this, is there, Matt? This is one of those situations that there's been dozen or so deaths along the Pacific Coast, Washington and Oregon from this excessive heat.
We need to take time to check on the elderly, the people that are more vulnerable. Also, remember to leave water out for the dog, that type of thing. Get the kids inside. Give them some ice cream. Give them an ice pop or whatever. Yeah. Anyway, to stay cool.
There you go.
Even the morning temperatures not particularly cool right now. We're seeing a lot of 50s across the area for these early morning temperatures, and we're going to continue to see these temperatures warm up throughout the day. A lot of sunshine on tap for the afternoon. Beautiful morning, but our temperatures are going to spike very quickly. Again, look for shady spots, find areas with air conditioning. Of course, go knock on that neighbor's door, offer them a glass of iced tea and a quick chat to check on them. We'll talk more about how long this heat's going to last coming up in just a little bit.
So as a reminder, hot weather also bringing an increased level of wildfire danger across the Treasure State. You can stay ahead of Montana wildfires anytime, anywhere with the free KBZK KXLF apps. Take our coverage with you by downloading our mobile news and weather apps in the App Store and Google Play. You can also watch our coverage on your schedule with the KBZK streaming app from Roku and other devices. See everything available to you on our websites, kbzk or kxlf.com/apps. 6:34 now. State officials warning that the alarming increase of fentanyl-related fatalities in Montana that occurred in 2020 does not appear to be slowing down into 2021. Montana Department of Justice's State Crime Lab reported 41 fentanyl-related deaths in 2020. Through May of 2021, there have already been 22 total confirmed fentanyl-related fatalities, including 11 statewide in April alone. Dan's Alexia Aguayo reports on this disturbing trend.
Fentanyl is a synthetic opioid. It was developed for pain management during the treatment of cancer patients and is about 50 to 100 times more potent than morphine. Montana state officials say due to its powerful opioid properties, fentanyl is illegally manufactured and abused.
The popularity of fentanyl has increased simply because we've gotten better at controlling opioids, better at the prescriptions. So when it gets harder to get an opioid from your physician, you're going to look for something else as a resource. It used to be heroin. When fentanyl is 100% more potent and you need less of it, all of a sudden it becomes more popular, even though the risk can be fatal.
The Department of Justice believes that fentanyl is being sold as a substitute for heroin. They say counterfeit pills disguised to look like legitimate prescribed opioids but contains fentanyl have been found in the state, which is why the DOJ partnered with the Department of Public Health and Human Services to send a message statewide that fentanyl is a risk to everyone.
There's a great risk to EMS and law enforcement if they encounter fentanyl simply because of it can be airborne and it can really have some difficult medical consequences. So we're certainly making everybody aware of it.
More than fentanyl, overall opioid overdose calls had a similar uptick this year. In March of this year, emergency medical services responded to 68 opioid overdose calls, the highest number of calls received in the past 3 years in Montana.
This is really about awareness. We rely on the general population to bring awareness to these incidences and to these concerning trends. And I think we all need to link arms together. That's how we're going to try to solve this opioid epidemic.
In 2020, Montana averaged 45 opioid overdose calls per month. Thus far in 2021, the state has averaged 54 opioid overdose calls per month. In Helena, Alexi Guayo, MTN News.
Alexi also says state officials are urging people to become familiar with naloxone. It's a medicine that should be administered anytime there's a suspected overdose. Naloxone can help save lives from overdose. It's safe even if the suspected person has not taken any opioids. And many law enforcement officers in southwest Montana are trained to use it, and they do have it with them in their patrol vehicles. 6:37 now. Dr. Anthony Fauci says the Delta variant of the coronavirus, the greatest threat to eliminating COVID-19 yet. The highly contagious variant, which was first found in India, continues to concern health leaders worldwide. Dan Grossman looks at what the difference about this variant, why doctors say even those who are fully vaccinated need to heed some caution.
When we need answers, we turn to experts.
So in your informed opinion, just how concerning is the Delta and Delta Plus variants?
Experts like Dr. James Nye, Director of Infection Prevention at one of Colorado's largest hospitals, who can dispel fact from fiction.
The good news is that the vaccines are still holding up, the best we can tell. My level of concern hasn't changed. COVID has the potential to be a severe, lethal virus, and we continue to see it, albeit thankfully at lower levels.
The Delta variant of COVID-19 is like any of its other variants, a natural mutation of the virus so it can stay alive. And so far, it has been succeeding. In the UK and India, the Delta variant now comprises more than 90% of new COVID cases. And in the US, that number is rising as well, as it makes up 20% of all cases, compared to only 1.3% of cases last month. The CDC says that percentage will only increase as the number of Delta variant cases in the US is expected to double every 2 weeks.
You said it's because it's the virus's way of surviving. Is this due to the vaccine, or is this just normal adaptation that always happens?
This is normal adaptation that is influenced by a vaccine. So certainly the vaccine has been a huge challenge for the virus, for sure, but not a big enough challenge. It continues to do well.
Researchers estimate the Delta variant is 50 to 60% more contagious than the Alpha variant, or UK variant of COVID-19, which was already 50% more contagious than the original coronavirus. But the vaccine still works well against it, as most of the cases still appear in the unvaccinated.
What makes the Delta variant so highly transmissible and so different from the original COVID virus?
We certainly know that there are mutations within the spike protein itself.
You were mentioning how there could be changes in the spike protein. Because the vaccine targets the spike protein, does that mean changes to the spike protein could render the vaccine less useful?
That's the concern. But, I think that's what the virus is constantly doing. It's constantly changing its ability to bind and be successful at adhering to somebody's body and spreading within somebody's body. So that's a known strategy of the virus. I think it's been very impressive how well the antibody responses have held up.
As has been reiterated so many times in the last year and a half, hand washing, masking, and hygiene, even among the vaccinated, remain the best defense to sparing more of these cases, especially in those who have yet to get vaccinated. I'm Dan Grossman.
6:40 now. Americans receive nearly 130 million robocalls a day. Yeah, a day. But today is the last chance for phone companies to adopt new technology that could stop many of those calls. CBS's Dina Demetrius explains.
They're the calls no one wants to receive.
I've noticed that I've been getting tons of them.
On a bad day, I've gotten over 6 before.
It's really annoying. Most of my calls I let go to voicemail.
The calls are often scams. Con artists can spoof numbers to make it look like it's coming from your area code or even a government agency.
This call is regarding to your social security number. We found some fraudulent activities under your name.
But many of these messages could soon be blocked. The FCC deadline is here for every major U.S. phone provider to adopt a technology called Stir Shaken, which validates a call and means the number you see is legit. CNET's Ian Schur.
So in theory, a fake phone call or a spoofed phone call will not be able to get through. Shaken and Stir is supposed to be built into the networks, so you won't have to do anything for it to work.
It's hoped Stir Shaken will significantly cut down the number of robocalls we receive, but it won't completely stop them.
Whenever you build any type of security, people are going to find a way around it.
For example, spam callers are still able to buy legitimate 1-800 numbers or go through overseas phone companies that don't have the Stir Shaken technology. Schur says that's why you shouldn't answer calls you don't recognize.
When you pick up your phone and the scammers know that you're on the other end of the line, they mark you as someone who could potentially be a victim one day. And they actually sell your phone number to other people saying, hey, there's someone on the other end of this who's willing to pick up.
There are other ways to hang up on scammers. Many companies offer apps with extra protection that can help make sure the calls you receive are real. Dina Demetrius, CBS News, Los Angeles.
Don't answer the phone if you don't know the number. 6:42, are you working this July 4th holiday weekend? Yep. If you are, you might be collecting some overtime pay. One business offering its workers double overtime this weekend. Coming up, find out where that's happening. But first, let's check in with our friends at CBS This Morning to see what's coming up at 7 o'clock.
Good morning. Ahead on CBS This Morning, officials say a grand jury will look into the causes behind the deadly condo collapse in Florida. We'll talk to one investigator leading the push to get answers. Also today is the deadline for wireless providers to start using technology to stop annoying spam calls. Only on CBS This Morning, why it's taken so long to get relief from robocallers, and reining in the cost of insulin. We have a big announcement from Walmart that could be a huge help for patients with diabetes. All coming up when we see you at 7.